I do have this question for you because there is filtration in it, but it isn't a vast filter that catches everything. But what is it actually filtering? What do you see in that canister on the side that sometimes foams up? Sometimes there's a little liquid. I myself didn't have too much, just a bit of foam in there when I did it in our training days. I was the first guinea pig.
Yeah.
What's going on with the filtration? Because I've heard different things that, oh my God, it's filtering so many things. I've had Michael Lowe on, who's kind of an expert in the ozone world and everything, saying, yeah, it's getting some of the bigger things, but it's really not like a true filter, let's say dialysis or something else would be doing.
Yeah. Great questions. And the ultimate, we as a ozone community are still figuring that out.
Yeah.
That's the truthful answer. Nobody knows for sure. What I can say though is that it's definitely bringing something out. There's that like you said, that liquid and the foam, and some people have a lot, and some people have a little bit. Some people have almost none. Inside the filter, the blood is going cross current with the oxygen and an ozone, and so they're coming in contact over about 1.5 to 2 square meters. So it's a big contact surface that again, this ozone is really just coming into contact with the blood. And you can see it, as you alluded to, you see it, you know something's happening because the blood turns brighter, healthier, reddish looking, right? And so what's coming off of that? Oxidized proteins, probably some inflammatory fluid. I can say, and I was just at a ozone conference and talking with some of the other speakers there, and I was a speaker, and anecdotally speaking, people tend to have more liquid and or foam come off in the beginning, and then it kind of decreases. And it seems like the healthier someone is, the less they have come off. There's been other people who have actually cut those filters open and put them under microscopes. And I think it's very apparent that those filters do catch a lot of toxins, including spirochetes and co-infections and parasites, right? And so there's definitely a lot of stuff coming out that we don't want in the body. But how much is the question? And how therapeutic is that, right? Is that really part of the truly healing part of EBOO? I don't believe it is. Because when we're talking about, take the Lyme spirochete as an example, right? We don't suffer because we just have a whole bunch of Lyme spirochetes in our blood and nowhere else in the body. Right. And people with chronic Lyme know this, but those who don't have chronic Lyme might not realize this. The spirochete actually goes into the tissues and sits there, and there's different forms of it, and it can lay dormant deep inside of the tissues. And so if we're doing a blood treatment session, an EBOO treatment session over the course of, some people it's 45 minutes, some people it's over an hour, but we have 2 liters of blood going through. Well, it might be taking out, even if it took out every spirochete that happened to be in the blood at that time, that is a very small percentage of the total body burden of spirochetes. And so if we are taking, call it 1%, because I'm guessing it's probably 1%, probably less, but I think 1% of the total body burden of spirochetes is very generous to be floating around in the blood at any one moment in time. So call it, we take off 1%. How therapeutic is that? It's therapeutic, but how therapeutic? Probably not much. So I don't think that I think just thinking through it logically, I don't think that the filter is truly the most beneficial portion of what EBOO is doing to us. Is it taking out toxins? Is it taking out those things? Yeah, to some extent.
Yeah. It's one of those things, again, the visuals, it's nice. I think it's the patient, oh, look at this. It's filtering this, and it's got out of my body now.
Yeah.
But the real magic and the healing happens with the ozone that is now within the body, your oxygenated blood, the UVBI that is anti-pathogenic, anti-inflammatory response that then spreads through the body and elicits a self-healing. It's almost like instructions, right, for the body to kick up on these things. It has more energy now in the mitochondria, as you said, ATP, to defend itself, to arm itself and go after the pathogens that are the 99% within the tissue everywhere else within the body. So I think it's a nice piece to have within EBOO, but as you said, I don't think that's where the healing actions are really coming from within it.